Hmm.
Hello, everyone. Welcome to our special podcast episode in honor of World Alzheimer Day, which is celebrated on the 21st of September. Today, we aim to raise awareness about Alzheimer disease, a condition that affects millions of people worldwide. We'll be discussing the nature of the disease, risk factors, symptoms, and the various ways it can be managed. So, our goal is to provide valuable information and support to those who are affected by Alzheimer disease and their loved one. As the population of Pakistan is becoming old, and we see our grandparents and parents living longer, this is a disease that affects a lot of people, even in Pakistan and South Asia. So, we have with us Dr. Hina Jawaid. Welcome, Dr. Hina.
Thank you. Good to see you again.
Thank you very much, Dr. Hina. So, could you start by explaining what Alzheimer disease is and how it affects the brain?
Okay. Alzheimer's disease is one of the diseases which is the most common cause of dementia.
Mhm.
Uh, and the way to explain Alzheimer's is it's a progressive disease which develops slowly, sometimes after the age of 60, 65. So it is related to aging. Um, it's a degenerative disease, which means the organ, which is the brain in this case,
Mhm.
loses its function and its structure over a period of time. And one of the risk factors is aging for Alzheimer's. And it develops very slowly. It's a progressive disease, um, and there are ways to kind of deal with it. So, an individual would lose their cognitive functions, so thinking, conceiving, reasoning. This is something which they lose. Sometimes you observe certain changes in the behavior, so they appear confused, agitated, angry. Things like delusions and hallucinations also accompany. So it is something which needs to be explained to the relatives, which normally come with the patients, and they say, oh, my parent is getting forgetful. They are losing the keys for the car, or when they're leaving the house, they're turning the stove on and they're not shutting it off. So they're getting forgetful. The day-to-day activity is affected. So that's what Alzheimer's in a nutshell is.
So, I do these things a lot. So, um, so, tell me, what are the primary risk factors associated with Alzheimer disease? And are there any lifestyle or genetic factors that can increase the risk?
Okay, so as I said, aging is one of them. Having any head injuries in the past
Mhm.
can be a risk factor. So when we look at the environmental risk factors, family history. So if you have a family history, and yes, genetic risk factors are there. So there are certain genes relating to proteins, for instance, apolipoproteins. They have been linked to development of sporadic cases. Other conditions like having high blood pressure, diabetes, high cholesterol, so obesity, all these, diabetes is linked with it. It increases your chances of developing Alzheimer's dementia, put it that way. So having a healthy lifestyle, more activity, physical activity, making sure your blood sugars are within normal range, they reduces the risk.
So,
Educational status.
mhm. Mhm.
Sorry.
No,
Yeah,
no.
educational status is also linked with, so people in low socioeconomic areas,
Mhm.
races like Caucasian races, they have been linked with development of Alzheimer's disease. Yeah.
So, sorry, I interrupted you, but my question was that so you were saying diabetes is a risk factor. But even if the diabetes is controlled, even that is a risk factor?
Um, well, uncontrolled diabetes certainly is,
Okay.
but if the diabetes is controlled, otherwise, if we look at the whole picture in a way, people who have the diabetes control are people who are usually active.
Mm-hmm.
Uh, their weight is within the normal range. So, and if somebody in an age group which is towards the elderly, they are maintaining their weights, they are still active, then that's a plus sign. It means that they are mentally active as well. So they do not have a sedentary lifestyle, and their brain is active and they are engaged in certain type of activities or thinking process. So if you reverse the condition and look at an individual who is aging and has put on a lot of weight and has got an uncontrolled diabetes, now those individuals, they are more at risk of developing, losing the cognitive function across all cognitive domains. So it's not only a cognitive domain like language, orientation, registration of information in the brain. So the different levels are affected. So yeah.
All right. So you did start by telling us that people complain of leaving the stones or a stove on or something. So these are the initial, perhaps, warning signs. What are the common signs and symptoms of Alzheimer disease that people should be aware of? And how do patients typically present with Alzheimer?
The usual thing is, well, sometimes, most of the times it's, oh, my father or my mother is forgetting things. They appear confused. When I'm talking to my mom, she's spaced out. She asks me about something which I've told her 2 minutes ago. So it's and giving us the impression that probably the memory is getting affected. They start forgetting names of the people and the loved ones or the place. Sometimes if they are living on their own, the elderly, they're using some form of a transport, they forget their address. So they have difficulty finding the right word when they are talking. Uh, and if they have kept something safe, they find it difficult to find out, even though the other person may be able to find it very quickly, but they keep searching for it, searching for it. So there can be memory loss, recent or remote. If they have a doctor's appointment or any dentist appointment or any other appointments, meetings, then they tend to forget. They can appear confused, agitated. So if their sleep is affected at night, then they tend to wander about. They appear disoriented. So time, space, person, there is disorientation. They won't be able to tell you what day of the week it is, which month we are, which year it is, what's the date. They may get put off by food, so they may not feel hungry. So things like behavior changes and psychological changes. So anxiety, agitation, depression, not getting engaged with the surroundings, with the people. At times we've noticed things like incontinence. So the ability to look after themselves, like going to the toilet, taking a shower, um, uh, opening their bowels, changing their clothes, things like these are affected. And these are the areas which require high degree of care. And then you have to have those difficult discussions with the family, whether there are people to look after them at home, or do you want them to be moved to a place where they can be looked after 24/7? And by that, I mean places like care homes. But obviously, care homes are not that easily available in countries like Pakistan or South Asia. And only those who are affording and can afford it privately can do it. Or they arrange for carers at home. So it could be depending on whatever is the arrangement for the family.
So, Dr. Hina, the sign and symptoms that you were talking about, most of those sign and symptoms seems to be those that the other people notice. So, my what I got from this discussion was perhaps the person who has the Alzheimer disease, they are not very aware of what is happening to them, and it's the people around them that they notice. Am I right?
Yes, and and diagnosing dementia, because one of the means through which we diagnose any condition, let alone dementia, is the signs and symptoms. In this condition, yes, you're getting more information from a third party. Patient may be denying all that, or patient may say, "Oh, yes, got to I left my keys in a bank the other day. I left my house keys there. I couldn't find them. They may be able to remember. They may be able to say, oh, we left the door unlocked when we left our house. But usually they are having difficulty recalling those events. And sometimes they say, no, it's just my husband or my children. They are just getting too snappy. They think they have to repeat things without realizing that they are actually requiring repetition because they are losing that memory. So yes, there can be a discrepancy between the two statements. And as part of kind of leading to diagnosing it, we have other means like a mini mental scoring evaluation, which is like an 11 questionnaire thing, which we ask from the patients directly. So that gives us an idea how much they are scoring. So it has got about 11 questions,
Uh-huh.
and the total score is around 30. So, and then you rate the Alzheimer's based on the scoring. So anybody who scores 23 or less is considered to have got a moderate to severe disease. Mild Alzheimer's is somewhere between, if somebody is scoring 21 to 26, that's mild Alzheimer's. So the questionnaire basically tests things like whether you're oriented in time, place, and person. Are you able to register the information? Are you attentive? There is a bit of a calculation in it, recall in it, checking the language. Are you able to draw a figure that is being shown to you? So if they're not able to draw the figure correctly, then you realize that there is some disconnection. The orientation is not there. They are not following, or perhaps the brain is not kind of reading the message as it should be. Yeah.
So this mini mental test, is this an investigation when the people come to you with symptoms suggestive of Alzheimer, or there are other investigations also that could be conducted in primary care to confirm the diagnosis?
It is not, mini mental score is not diagnostic, but it is like a screening tool.
Okay.
And it gives us an idea because as you mentioned earlier, that it's usually the third person who is telling us the information. So it is our way of having an interaction with the patient
Mm-hmm.
and think how much their brain is functioning at the different cognitive levels.
All right.
Yes, there are other tests that we do.
Mm-hmm.
And they include a set of blood tests.
Mm-hmm.
Uh, and there's a whole list, in fact, that we do in order, because diagnosing dementia
Mm-hmm.
can be a bit difficult. And I'll give you the reason why. For instance, if somebody has got a urine infection, like what we call as a UTI, they can appear confused, agitated. I'm talking
From
about
old
the
age.
elderly.
Yeah,
Yeah.
elderly. Okay. Yeah.
Similarly, if your thyroid function is off,
Mm-hmm.
if you're hypothyroid particularly, then if your sodium drops, you
Mm-hmm.
appear confused and you got other problems. So there's a set of blood tests. So what we do, we start off with basics like checking the full blood count to check for anemia or infection.
Mm-hmm.
We look at the kidney, so urea electrolytes to make sure your creatinine, your glucose,
Mm-hmm.
your sodium is okay.
Yeah.
Then we check for liver function, and particularly important are checking for vitamins like vitamin B12 and folate. Their deficiency can affect brain function. It can give rise to sensory and motor symptoms as well in
Mm-hmm.
hands and so thyroid, as I said, then ESR test for things like in elderly, you have to rule out vasculitis, like temporal arteritis and other conditions similar, which can be common in that age group.
Mm-hmm.
Um, we tend to do ECG to make sure the heart is functioning okay. There are no heart blocks or there are no arrhythmias. A chest X-ray to just look at the lungs for any sinister lesions, and a urine sample again to check for infections. So this is a whole list of
Mm-hmm.
tests. Um, in addition to that, obviously, we send patients for a CT scan, MRI of the brain to look for any other cause of altered behavior, like space occupying lesion, a tumor, or things like hydrocephalus, or any features of infection. In Pakistan, obviously, we have to think about things like tuberculosis as well. So there's a whole set of investigations that we do, but mini mental scoring is something which we can do in private practice, sorry, in the primary care practices within our practice to assess the level of patient's cognition. So yeah,
So, like you said, it's a
it
screening
is.
test. So, before we go to management, Dr. Hina, one of the questions that keep coming up to my mind again and again. So, we're talking about Alzheimer, and we're also talking about dementia. So, are they the same thing, or there is some difference between dementia and Alzheimer?
Uh, Alzheimer's is the most common cause of dementia.
Okay.
Dementia is basically the losing of the memory and the
Mhm.
losing of cognition and the other signs and symptoms that I've explained.
Okay.
Dementia can be caused by other conditions like Parkinson's. Parkinson's is one of them. Okay.
Okay.
Then there is Lewy body dementia, and then dementia can be caused by other conditions.
Right.
Use of alcohol, again, which affects other organs, then brain can also be affected. But Alzheimer's is uh, because we have discussed the risk factors. There's no
Yeah. Yeah.
specific etiology. There are set of risk factors associated with it,
Yeah.
and it is a common cause of dementia. So yeah.
So yeah, that explains it. Thank you for that. Now let's discuss management strategies for dementia, which are caused by Alzheimer disease. So, what treatments and support options are available for patients and
Mhm.
also their families?
Okay. You have to, once the diagnosis is established, then you have to have a chat with the patient, and with the family, including, because this is where uh, the capacity of the patient, which means the mental ability to make a decision, can be affected.
Mm-hmm.
So it has to be, it cannot be like a 5 minute talk. It has to be a longer one where you have to explain to the patient and the family what this condition is, make sure they are understanding, and make sure they have the understanding of how it is managed. And it is not going to be a matter of a few hours or few days with a full recovery.
Mm-hmm.
It could be as long as the patient is alive. There is a possibility that he's going to get worse, he or she is going to get worse than what he or she is now.
Right.
So they will be needing a day-to-day care.
Mm-hmm.
They may be needing medications.
Mm-hmm.
They may need some non-pharmacological support in the form of cognitive behavior therapies, or in form of medications to reduce their in terms of maintaining healthy lifestyle. Um, um, in our part of the world, obviously, we don't use things like meditation, music, and dance by the elderly population, but it is one of, but for instance, if elderly population wants to engage into some kind of activity, some kind of a hobby, indoor or outdoor,
Mm-hmm.
make sure they remain engaged. What also helps them, if you put a list of things like reminder notes.
Mm-hmm.
So, for instance, in our kitchen table or on the fridge, we use magnets and hold papers and say, do this. So
Mm-hmm.
today's date, tasks to do, so
Mm-hmm.
that there's something written in front of them and it's like a reminder for them.
Okay.
Um, yeah, and if there are family members who are willing to help them, then make sure they remain engaged. They're not feeling lonely, left out, because that affects their mentation, adds to the loneliness, depression, and anxiety, helps them with day-to-day things. Yeah.
Yeah, I understand. I mean, having Alzheimer, I think it's very difficult for the patient, patients particularly. I mean, when I'm thinking of my parents and grandparents, so they have a um, very active life, and then when you become old, you gradually become dependent, and then when if dementia or Alzheimer hits you, that can make old age very challenging. But so what about the carer? I mean, and the reason why I'm asking you, Dr. Hina, is because one of my friends, her husband, rapidly, I mean, he has a Lewy body dementia, and it just we found out about it, I think last year, and he rapidly deteriorated. And so I mean, because they're living in New Zealand, so for her, there is support system available. But one of the things which she also complains is about the carer exhaustion. So
Yeah.
the carer exhaustion is also one of the challenge. Um, so in countries like Pakistan, where people are not very aware of or do not have very in-depth understanding of Alzheimer, when they see their parents and grandparents going into this condition, some of the younger generation become a bit agitated also. I mean, the person himself is agitated because they're struggling with themselves, but the carers also. How do you think that a primary care physician can handle that situation?
It all comes down to having an open conversation. And as I said, if you're managing that patient from the beginning, when
Yeah.
they first brought the patient, the family first brought the patient, when you were suspecting or they were suspecting, you have to have the conversation about the prognosis of the condition,
Mm.
uh, the likely outcome, how realistic you can be,
Yeah.
because that is the time where the family will be preparing itself mentally.
Yeah.
They may be looking out for the various possibilities, like who can be available for support,
Yeah.
how are we going to manage it, how are we going to divide the days, who's going to look after our relative, the
Yeah.
elderly one in question, how are they going to arrange the finances, if the elderly person has got any property, is it the time for it to be kind of a decision to be made,
Yeah.
how are medications going to be made possible, because we do tend to give medications in certain cases. So a mild to moderate dementia can respond to medications, but again, medications on their own do not work.
Mhm.
It is the support system, the non-pharmacological things that come with it. So it's a whole thing, and some cases do get worse with time.
Mhm.
And mind, there is no prevention of it. It is a condition, as I said earlier, having a healthy lifestyle, um, uh, uh, being non-diabetic, keeping your cholesterols within normal range, your body weight and the blood pressure, that's a good thing. But not everybody is the same. So people who get a progressive disease and the Alzheimer's gets worse, they do come to a point where that you end up having to provide them a palliative care,
Mhm.
um, maybe bedbound. They may not be able to get up and go to the toilet.
Really?
So it is something you have to. I know in our part of the world, people say, "Oh, please don't give us more information. We are getting frightened."
Yeah.
But it's better to know it now than to know it at the time, because if you have the information before to hand, things like awareness days, these are the days where I think these kinds of talks need to be held,
Mhm.
and you have to be as realistic as possible, you have to be as factual as possible, because there may be a point where you are not able to even look after the patient at home.
Mm.
You have to make an arrangement
Mm.
somewhere. So what that somewhere is going to be. The patient may be needing an endoscopic tube or a nasogastric tube for feeding. They
Okay.
may have difficulty swallowing and
Right.
the speed. So there may be a point where you have to pass down a tube to help them feed. So we don't know, because at the beginning it's difficult to predict. Every individual is different. So it's better to be aware rather than go into an avenue where you take support of myths and misconceptions. So you have to replace those with reality, basically.
Okay, that's pretty scary. Because I was thinking of asking you how should we prevent, what should we do to prevent us from getting Alzheimer or dementia? But you answered it that it's not preventable. All we have to do is to maintain a healthy lifestyle.
Yeah, these are the modifiable risk factors.
Yeah.
So the ones, but things like aging, for instance, if somebody has an injury to the head, if somebody, again, alcohol is a modifiable risk factor, but having Parkinson's as the
Yeah.
cause of dementia, I mean, there's little you can do about to prevent it. Um, so yeah,
So
these are some of the.
age, genes, and
Yeah.
any condition, for instance, head injury. If that happens, so that becomes a non-modifiable, and the modifiable are um,
Yeah.
lifestyle factors. Thank you very much. It was quite scary, but it's quite informative. So, what are some takeaway messages that you think you would give to the general practitioners who would be managing these patients in their practice?
Um, um, there is a lot of information, evidence-based information. And having labeling somebody as having dementia is basically like breaking bad news, not only for the patient but for the entire household. So make sure you've got good evidence-based knowledge on it. You're up to date with it. Make sure you carry out all the processes like doing a mini mental score. It takes only 5-10 minutes. It's not long. Do spend a certain amount of time. Spending an extra 1 or 2 minutes on the patient will save you and the family in the long run. Make sure you carry out all the investigations, particularly the blood tests. So if it comes out to be, oh, patient was low in vitamin B12,
Mm-hmm.
that is something which you can treat.
Treatable.
Or it was thyroid, which was the problem.
Yeah.
Yes, the replacement is available. Or patient had a UTI. Yes, that was the cause of the confusion. So make sure the entire checklist is there before you do that. But once the diagnosis is established, always follow the the reality that the disease is progressive, what non-pharmacological measures are there, and what medication forms of measures are there. And it's an ongoing process, and there's no quick fix to it, because we like going to other traditional healers and quacks. So make sure, as a primary care physician, you have the command on this topic and you're able to provide information to your patient.
All right. Yeah, I think that's very important because once you label a patient with Alzheimer, it not only brings anxiety to the patient, but you can't reverse it. You can't say that, oh, I had Alzheimer. Last time I thought that he had Alzheimer, but this time I think that he didn't sleep well. That is why he was acting like that. So yeah, that's a good advice. Anything else that you want to add to the discussion today before we conclude?
Um, um, I think when these awareness days are coming,
Yeah.
make sure you are not yourself aware as a primary care physician, but you take measures to arrange small talks, provide information leaflet in local language to your population. So make sure you've got enough information in your waiting area where people are coming, they take that leaflet, able to read it, and encourage them to go back to their homes and talk to their relatives and inform them as well. So information sharing, making the local community aware is something that will help us identify it earlier.
Do we have such leaflets or such organizations who cater to people with Alzheimer disease? I mean, do we have leaflets in our government or non-government system in Pakistan? And do we have any organizations that provide such information?
In the West, there are plenty.
Yeah.
In Pakistan, and it is something you have to search. You may be able to find in big cities an organization which may be able to support you, or somebody who has somebody in the family. They are like peer support groups are there,
Okay.
but they are not available as an option in most public sector
Understood.
institutions. They are not available to majority of our population.
Okay.
And as I said, the level of education is important to understand certain diseases. And Alzheimer's, unfortunately, is one of them,
Yeah.
where you have to good connection and ability to understand,
One
to deal
final
with it, to
question.
cope.
Yeah, one final question that just came up to my mind. So you were talking about initially, you were talking about the socioeconomic status and education. Um, I may have missed it, but is there any evidence that it affects people of high educational status or low educational status, high income or low income, or there isn't any distinction between that?
Um, the I'll just take out
The
the
reason why I'm
reference.
saying that is I remember my father used to say that keep on reading and keep on reading till the end. It keeps your mind active, and your brain stem from not dying. I mean, I know that we in medical field also say that the more your brain is active, the more you're healthy. Reading, walking gives more oxygen to your brain, so that will keep your brain cell active. But yes, I mean, is it that highly educated people, whether they are less affected or no?
Um, okay. The evidence base say people who have low educational achievements,
Hmm.
they tend to develop
Okay.
Alzheimer's. Yeah. They are more predisposed to, they are more vulnerable to, or at risk. Same they go in the same list as people who have got diabetes.
Yeah.
Uh, they are at modest risk of having affected cognitive function.
Hmm.
Same as the list of people who've had head injuries. Now, peop one of the non-pharmacological methods of dealing with dementia is to encourage people to do a lot of crossword puzzles.
Yeah.
And it is one of the ways to kind of enhance their cognitive function.
Yeah.
So, um, uh, so having a higher educational achievement
Yeah.
is inversely related to
All
development of
right.
Alzheimer's. But it's lower, then there is more risk. And that is why I said earlier, it's important because this condition is one of the difficult ones to explain to the patient. So people from the educated background may be able to understand it a bit better, maybe.
Yeah.
Yeah.
Yeah. No, it makes sense, because people, if in low income and low socioeconomic status, may be exposed to more. We did not talk about toxin, but more environmental hazards, more diseases, non-communicable diseases are higher, communicable diseases are higher. So it does make sense that people at the lower socioeconomic gradient may be more at risk. Having said that, I mean, you did not say at any stage, or I mean, I didn't get it from any stage that you said that the people in high socioeconomic status would not be at risk. So the risk is there, but it's higher for the low socioeconomic. The risk is there for the high socioeconomic status people also, possibly because if they are smoking or having alcohol, having poor lifestyle, so they are also at risk. But yeah, so am I right in my
The yeah, in a way you're right. Low socioeconomic, but um, in relating in kind of connecting the Alzheimer's with education, that was the only thing. With
all right?
economic status wasn't that kind of uh, connected with it, but educational status was, yeah.
Okay, that's thank you very much for clarifying that. That's good to know that socioeconomic status is not, but educational status is.
Yeah.
Thank you, Dr. Hina. I think it was quite informative session, and I think the viewers would have learned a lot. So if there are any question, I would suggest that they can post it under our podcast. And thank you very much. We'll talk to you pretty soon again on another exciting topic.
Okay, thank you.
Thank you.